So guys, now we're going to actually talk about the right heart failure. We have actually discussed in very detail about the left heart failure, but today, now we're going to talk about the right heart failures. One of the common things that I would like to tell you is that the right heart failure, one of the secondary cause of the right heart failure is your left heart failure. If you want to be very, very clear, that does cause that. Other things that I also wanted to share to you guys is that if you see these diagrams, and as I talked about it, it will make more sense to you guys, right? So basically, right heart failure, as I said, the secondary cause could be because of your left heart failure, and other could be because there's a term called cardiovascular. Okay, what does that mean? What basically means is that this is isolation to the left heart failure. What basically means is that your ventricles is going to have whenever your right heart fails, you're going to have an increase in right atrial pressure, meaning your right atria. You're going to have a right ventricular pressure increase in pathologically high. You're going to have a increase in pulmonary artery pressure down here, and obviously you're going to have an increase in, because if there's a right increase in right atrial pressure, that means what is going to happen is that whenever this contract, there will be increase in your central venous pressure or your internal jugular pressure, right? So, but you'll have all this pressure, you could say, but if it's not because of secondary heart failure, then your secondary heart failure, if you based on the pulmonary wedge pressure, if you look at the left atrial pressure will come out to be normal. Okay, so if your left atrial pressure is normal, but all these things are your right side, it has actually is higher, pathologically high, then you should know that this is called pulmonary, which has nothing to do with the left ventricle, left heart. It probably has to do with some kind of problem that is with the right side of the heart. Okay, now with the right side, we talked about the conditions because infractions, or maybe the overdose of antiarrhythmic drugs, ischemic conditions, myocardial infections, dilated cardiomyopathies, those could result into this right heart failure, right? Or we talk about left heart failure, but same thing could happen on this side too. When it comes to valve, we don't talk about the aorta and mitral. In the right side, we talk about the tricuspid. You could have tricuspid regurgitations, or you could have pulmonary regurgitations, or you could have pulmonary hypertensions, right? If you have tricuspid regurgitations or pulmonary regurgitation, it's going to give you systolic dysfunctions. If you're talking about, let's say, pulmonary stenosis, then if you're talking about pulmonary hypertension, this can give you something called systolic dysfunctions over the time, right? Because you're talking about pressure overload, versus your volume overload. And then obviously, if there is some kind of restrictive disease on your lungs, like COPD, or because of smoking areas because of long-term smoking, right? There's a lot more resistance. But this pulmonary become a lot more restricted, maybe because of sarcoidosis. So really, what happens is that your right ventricles from the pulmonary artery, it's difficulty for this artery to actually bring the blood into your capillary networks of your lungs. Okay, so because of that, what happens? Because there's a lot of resistance there. Because of that, there will be a lot of pressure that will build up on your pulmonary artery. If there's a lot of pressure is built up here, the ventricle is not able to generate enough pressure to put here, enough here. That means everything with back pressure happens. Then what do you remember? Then if there's back pressure, that means what happens with this right ventricle hypertrophy. If there's a ventricle hypertrophy, what's going to happen? There will be a lot more stress on the tensions of the ventricle wall, right? Ventricle wall. And because there's a lot of tension in the ventricle wall, what's going to happen is that there will be the sarcomere will get shorter, right? The sarcomere, not the sarcomere will go shorter. It's the sarcomere will be parallel, but there will be a loss of there will be those myocytes. The myocytes would not be longer, but it will be shortened. Because of that, there will be the endosteric volume would be decreased. Because of this endosteric volume is decreased, you're going to have a lower cardiac output, right? Now that's the thing. And those are going to be diastolic dysfunctions, right? Now, with the regurgitations problems, if this is let's talk about this. If it is hypertrophy, then what's going to happen is that this atria has to contract to generate enough pressure to actually propel the blood from your right atria to your right ventricle. So because of that, what's going to happen is that as force output is because of the extra pressure that atria has to apply in order to propel the blood into it. And because of that, there will be a permanent, you could have if you know the jugular venous system, what is the jugular venous system? Your graph looks like, right? If you look at this, usually it kind of looks something like this, right? So you have airways right here, make this a little smaller airwaves actually. Like, let's make this have a smaller airwaves, right? So you have this. Actually, it doesn't look like that. It kind of looks, right? Or something like this. So if we give this, like, let's A wave, C wave, and this is like, let's say X wave, X descent, and then V wave, and then Y, right? Something look like something like this. But if you have, like, let's say, the atria regurgitations, or this atria because it has to work on the over pressure, what's going to happen there? You could see a prominent A wave, like A wave would be going like this, like A wave. It depends. This is like really high, like, or it could be like something bigger. So you could see that, right? Now, or this is all I'm talking about the diastolic dysfunction. But if it was systolic dysfunctions, what do you mean? Which usually becomes the atrial contraction. We talked about the other side of the heart too. It's the same, basically same regions, all right? And then you can watch my left ventricle failure, so you're able to understand what are the things that could happen there, right? Now, let me take one of the conditions, and let's say, okay, there's some kind of stenosis, let's say there's a ventricle hypertrophy, or maybe right ventricle, or maybe there's a, let's say, tricuspid regurgitation, right? Because what really happens is that, obviously it is having difficulty on propelling the blood into this side, right? Or there's a less cardiac output, so this would be a right forward failures, because less cardiac output is going this way, right? That means a lot of blood volumes of this kind of hypertrophy. That means you're going to have what? This is going to be a right backward failure, right? So this is going to be a backward. It's coming to the backward side, really what happens, because it has to generate more pressure. So if it has to generate more pressure to propel here, or in that case, because in both the cases with the diastolic industry, you're going to have a higher pressure, right? So because of pressure, what's going to happen is everything is going to do like back pressure. So there's less cardiac output is going on, less back, so there is more back flow is going to happen. So it's going to go up, which is going to go with the superior vena cava and intrajugular vena. So you are going to see the jugular venous pressure with this right side of the heart. People with the jugular venous pressure, you always see as distended. Your jugular venous will be distended for people with the right side heart failure, right? Now, other things that if there is like lots of blood fluid, it's also going to come from the cable system, infravena cava. It's going to come back. And remember, as you know, from this one, from the left side is pumping the blood out for systemic circulation, right? And I just drew like some of this part of the system circulation. Let's say this is like brain, skeletal muscles, and kidney and GI. Okay, these are supplies to all the part of the body. And like GI, let's say I broken down into a bunch of things. Like I made a stomach here, and then also this is a pancreas right here. All right, this is pancreas. This is spleen right here, and this in blue color I call as a splenic vein right here. Okay, and this one, let's say this microgastric vein right here. Okay, and then this is a pancreas. This is a pancreatic vein. All right, and then from this one, let's say this going to the small intestine. Let's say, this is large intestine, but this is supplied by the superior mesenteric, right? So superior mesenteric vein, and then this is, let's make this one as like from here. There's also one vein coming, which is inferior mesenteric vein, right? Like from there, really what happens are these all guys come together, right? Taking the nutrients and all that stuff, and they're actually draining the portal system, like portal vein. And then from the portal vein, what is happening? It is bringing this liver sinusoid, right? So basically what happens, this is a hexagonal, this is a liver lobule, right? So what's happening, liver lobule, and they have the liver lobule, what happens to the sinusoidal capillaries, right? And then also, like from your system circulation, remember, there is a celiac trunk, right? A celiac trunk is there, and then from the celiac trunk, remember, they give branches to, like if you remember from the GI system really well, like celiac trunk gives branches to 3 rise, right? From around the level of T12 or so, gives rise like left gastric artery, and then which runs the lesser curvature of the stomach, right? And also supplies a little bit of branches to the esophagus. It also gives a splenic artery, right? And it supplies the spleen. And then the splenic artery gives one more branch, which is called left gastric artery, that supplies the fundus of the stomach, and the left gastric supplies another give, which is called left gastromental artery. Remember that, Allah? And also one more artery gives out is called common hepatic artery, and the common artery splits into your gastroduodenal artery, and then it also splits into hepatic proper artery. Remember that? See, you remember that kind of stuff. It is important. So from the hepatic artery proper, remember the hepatic artery goes and supplies to your liver. When there is a right and left liver, right? And the right hepatic artery, left hepatic artery, right? And they're also bringing the blood into it. The splenic artery, this splenic artery also, let's make this a splenic artery from here. All right? There's a splenic artery. And then from the splenic artery, so from there, so basically the liver has two drainage systems. One is from the system circulations, which is bringing the blood into, basically from the artery, and bringing into this your liver lobules. Okay, you just made one liver lobule, and then it's actually draining into sinusoidal capillary. Same thing with the portal vein. Portal vein also brings from all the GI systems and actually draining draining all these fluids into your sinusoidal capillaries, right? That's what these guys both are doing. And from there, this draw, let's say this is, what happens is, these guys all accumulate into, let's make this as a, like central canal. That's what they call, right? From the central canal, what happens is, the veins comes out from there. Those are called central veins, like small veins, and they all join and they become a, let's say, hepatic vein. And this hepatic vein drains into inferior vena cava. And then inferior vena cava drains right into. That's like a general concept, right? Now, there's bigger pictures. When liver, we'll talk about more detail about that kind of stuff. The reason why, so this is what is normally happening, right? So let's say when you use a black flow is happening. What is a black flow is happening? That means all this fluid is going to come this way, right? With the right failures, right? Look, when it's coming down here, look, this is coming and this is going to go to the hepatic vein, right? So that means the pressure on the inferior vena is going to go up. It normally is like 5 to 6 millimeters of mercury, right? So now this is a rising pressure, it's going to go up, and the pressure, that means like whatever this is coming in, because look, all this fluid has to come out to here from the central veins, and then it go hepatic veins, and then it go drain into inferior vena. But if the pressure is higher, the hepatic vein will not be able to drain the blood into it. So the back pressure is going to happen, right? From the back pressure is going to happen, and then from here, what's going to happen? All this fluid is going to go backwards, right? And then when the fluid is going to go backward, what's going to happen? What's going to happen is that when the fluid is going to go back and all that stuff, now all the fluid is going to go and they start leaking out, right? Leaking out from the liver, the capillary that goes interstices and all that stuff, right? So that means a liver sometimes can like move, which call them a pulsatile liver, okay? Pulsatile liver, we can call them at that. And because of the lots of fluids are coming out here, what's happened there? Liver will become edematous, right? And that condition, because right here we get this very condition called hepatomegaly, right? Now hepatomegaly, because liver is working with higher pressures, right? And it's not able to drain into it, and there's going to be a fluid that also going to start oozing out, so the liver becomes inflamed, right? Liver becomes inflamed, and you get a condition called hepatomegaly. Not only that, all this fluid is coming out down here. And remember, the postcapillary sphincters are not as good as your precapillary sphincters. Okay, that's on the arterial side. And all this fluid comes out, and it's going to oozing out from all these different types, like from here, and it's going to go to like the peritoneal cavity, right? From the in between the greater sac and lesser sac, or mental bursa, right? So between the greater sac and lesser, those are called peritoneal cavity, right? From the peritoneal cavity, what is going to happen? The fluid is studied from obviously there's an increase in hydrostatic pressure because the fluid is coming out, right? So because of that, all the fluid is going to start looking out, and then the peritoneal cavity is going to be with lots of fluid, okay? Now that's called hydroperitoneum, or we can say there is a hydroperitoneum or the peritoneal edema. And we commonly use, there's a term which is called ascites. Ascites is commonly used for the hydroperitoneum, which is the accumulation of fluid on your peritoneal edema. So ascites will occur, right? Because all this fluid is oozing out from the liver sinusoidal, and they will start going to the peritoneal cavities or so too, right? Down here. Now, not only that, what's going to happen is that the fluid from the system is going to go backward, and also it's also going to go to all systemic circulation too. Like when the systemic circulation is going to go back, because remember, this blood from the left side of the heart, it's not able to drain to the venous side, and not because of the pressure, and the left. So they're gonna like come together. Like for example, let's make this one. This is my venous side, right? And then if I make this a artery side right here, let's say. So really what happens is a capillary, right? So what happens is like the pressure is coming from this way, from the venous side, and also it's coming from this way. So because really what happens is that these guys will come here and then join there. Because of that, from the capillary, a lot of fluids is coming out. Then it's also going to go to all different parts of your body, right? Kidney, the GI, all that stuff, right? And that's going to cause edema. And it's called general edema, okay? All part of the system circulation. And we call this as anasarca. Anasarca happens because of your because of this is called general edema, right? Anasarca. And then most commonly you see lower extremities, you see a pitting edema, right? Pitting edema, which basically means as you actually especially in your shin bone or on your feet, really what happens is that if you actually try to pit it, right, it will move. Okay, the indentation will happen, right? Because that's usually because of increased hydrostatic pressure, okay? So the fluid will move or fluid will shift, and that is called your pitting edema. But there's also, with this, also there's a dependable edema, which basically means that your intestines have a lot of this fluid accumulated right here, right? So as you shift, It's more like gravity dependent. As you move, as you change your position, so like for example, if you're lying in a position, sometimes your edema will go back to your back. Okay, so those as you move based on the gravity, that's what we call them dependable edema, because with a lot of interstitium that is built up, there are a lot of fluid that is built up in interstitium that is probably sort of like compromise the glycoprotein that's holding the fluid usually. Okay, and if there is compromise in the glycoproteins, there will be the water channels will form, and because of that, all this fluid will start leaking out. All right, so that's what I want to let you know. And one of the things for the hepatomegaly is that, because of this fluid accumulated on here, and it's going to be a large liver, right? So because of that, there is this, you will feel the right upper quadrant discomfort too, because of right heart failure. So like some of the common symptoms, like you see the right heart failure is that, okay, you're going to have a jugular venous distension. That's one of the things. You're going to see hepatomegaly, right? And as I told you, what's how this hepatomegaly occur. Ascites, you can get to see it. Right upper quadrant distant, you're going to see a general edema. You're also going to see jugular vein distensions, right? So you're going to see that. And then this is very, very important that you understand these things also very, very well. Okay, now and then obviously the less blood is going to the like the cardiac output will be decreased on my right forward failure right here, because the less blood is actually going to the lung area. Right, that means that the less blood is going to the lung area. Remember, lung also work as a reservoir because they do hold some type of blood too, like and then especially like during expiration, the cardiac output on your left expiration, your left ventricle actually increases because they push that reservoir blood volume here too, right? So over the time, there will be also like decrease in blood. It's actually going to the left ventricle too, over the time. Now, so these are some of the things that I wanted to let you guys know. And also one more thing is, guys, like your jugular venous central venous pressure, jugular venous pressure is actually going to be distended. And also sometimes we say that there's also I want to make one thing clear is, like right atrial pressure and then central venous pressure is like not, usually we say exactly the same. The reason why is because there's no valve here. Okay, there's no valve here. Because of that, all the blood coming down here, it just directly drain into the right atrium, right? Because there's no valve here, so they usually sometimes they kind of ignore the central venous pressure. Okay, just want to let you guys know that too. And this is what's going to happen with your right side of the heart failures.